Hi, my name is Janice Law, and I am the incoming chair of the Young Ophthalmologist Committee. I am here at AAO 2018, and here with me is Dr. Lisa Nijm, who is a cornea specialist and a successful solo practitioner at Warrenville Eye Care and LASIK in the Chicago area. Young ophthalmologists today are less likely to choose a small group practice or a solo practice due to the changing healthcare environment. But Dr. Nijm has had a wonderful experience. Dr. Nijm, will you tell us what has been the most rewarding aspect of having a solo practice?
Sure. First of all, thank you for having me here. I'm actually just delighted to come and talk to young ophthalmologists about the possibility of having a solo practice, because I don't think that it's people are exposed to it enough to really kind of think about it and decide whether it's right for them. Just like group practice is not the right choice for everybody, solo practice is not the right choice for everybody. But I have found so much rewarding experiences in having my own autonomy and independence and being able to take care of patients the best way I saw fit that I enjoy my practice tremendously.
Wonderful. What lessons have you learned since hanging your own shingle?
Well, I've learned that it's a lot of work, but it's work that is worth it, because there's nothing like having your own business and being able to really set up the practice so you can best take care of patients, so you can offer them individualized care, so you can take care of them when sometimes they're rushed through larger practices and larger system to really get to the bottom of what's causing their eye problems and help them.
What tips would you give the ophthalmologist who's afraid of diving in and doing it? What are there next steps for them?
Yeah, absolutely. So I would suggest, first of all, coming up with a business plan and realizing that opening your own practice takes more time probably than you would think. You want to have a plan for space, what you're going to do with staffing, what you're going to do with equipment, getting on insurance panels and hospital credentialing. All that takes time, so you want to plan it out accordingly. The second thing I would say is that I would talk to your fellow colleagues. There's actually still a fair amount of ophthalmologists in solo and small practices who can give you tremendous advice. And we're unique, and ophthalmology is one of the few fields that you can open a solo practice and be successful and take great care of patients. So take advantage of that, because we're blessed to have that opportunity. And the third thing is to really utilize the resources in front of you. The Academy has some excellent resources with the IRIS registry and some of the practice management resources that can help you a great deal in how to set up your practice and how to be successful.
Wonderful. So it sounds like the Academy has a lot of resources for solo practitioners, and it's worth it to be able to take care of patients the way you see fit and to give them individualized care.
Absolutely.
That's wonderful. Thanks for being here.
Thanks for having me.